We know that implants are a great way to replace missing teeth. However, not all patients can have implants. So the fixed partial denture is the next treatment of choice. But there's some concepts of the fixed partial denture that really need to be looked at and fully understood. And one of the primary things we need to understand is the concept of the law of beams. And the law of beams states as the distance between abutments double, deflection of the bridge becomes a cube of its previous movement under a given force. In other words, FPDs bend, right? Doesn't matter if it's metal ceramic or if it's made out of zirconia. The longer it gets, the more it'll bend. So let's calibrate this. If we're going to say we're going to make a bridge that replaces one tooth, that would be the image on the left. There will be 1 unit of deflection for that length bridge. However, what happens if we double the length of the bridge? Say the bridge is now going to replace 2 teeth. Well, the deflection will be 8 times as great by doubling the span length. This is the law of beams. So people thought, okay, well, with a longer bridge, maybe we'll just add more abutments, right? That'll make it better and stronger. And yes, double abutting will increase retention, but it decreases resistance. And the result of this is increasing the risk of failure through loss of cementation of the secondary abutments. In other words, the secondary retainer as a primary abutment becomes a fulcrum. Okay? It's important to understand that there is absolutely no evidence that the use of a second abutment will protect a weaker one. Now let's take a look at why this is a problem and double abutting doesn't really work well. So if a compressive force is placed on the bridge, okay, the abutments closest to the ponic space will be under compression. The abutments furthest away will now be under shear or tension. It's important to recognize that all materials are strongest in compression and weakest under tension or shear. The cement, our luting agent, doesn't matter if it's bonded or not, are the weak link in the chain. So when we look at the physical properties of our luting agents, resin-based cements are really strong under compression, 200 megapascals. However, if you look at the tensile or shear strength, they're pretty weak, 34 to 37 megapascals. So you can see why the most outward abutments, secondary abutments, have a problem. And we can show all of this. We can show the forces. It's been done many times with photoelastic studies. We have finite analysis now. And when you look at the pressures that these abutments undergo, it is very clear that the abutment furthest away from the pontic space is going to be placed under tremendous tensile forces versus the abutment that is closest to the pontic space will be put under compression. So the most furthest away abutment is more likely to debond. How about a practical application? Let's take a look at this FPD. And I'm just going to ask, which tooth do you think is going to fail? Now, most people are going to look at this lateral and go, I think that one. Look at that big post. You can see almost a perforation in the preparation of that post space. Well, this case was followed by a colleague, and they sent me these x-rays. These x-rays are 8 months in between, and you note which tooth failed. The furthest away from the pontic space failed. The tooth under tension and shear. The cement failed, leakage occurred, and then decay caused the destruction of the tooth. So this is a practical application of the law of beams. I want to add one more thought here, okay? All single unit indirect restorations, their luting agent fails to buckle lingual off-axis loads. Fixed partial dentures are different. Because of this bending moment, fixed partial dentures fail due to mesial distal off-axis loads. So if you're going to place resistance retention features on a single unit crown, you want to place it on the mesial and distal walls. For an FPD, you want to place it on the buccal or lingual walls. Okay, so let's look at a couple clinical failures. This is an FPD that obviously came loose on the terminal abutment. The molar, you can see the staining of the cement, and you can see how short the axial walls are, and there are no resistance or retention features. Right? You can see my preparation. I lengthened and made parallel the axial walls, and I also placed very big buccal and lingual grooves. The lingual one's a little sloppy looking because I was fighting a tongue. I should have used a rubber dam on this preparation. I did not. But you can get this, a sense of what I did here. You can see the straightening of the axial walls as well as nice big resistance retention features. And it doesn't matter if it's metal ceramic or zirconia. You can see in this zirconia FPD where the terminal abutment, the molar, the cement failed, the staining, bacterial staining, I had to cut off the anterior abutment. But you can get a sense of the height difference in the preparations, right? We know we can increase retention by having a taller prep. And the shortest retentive part of a fixed partial denture is what's going to fail. So let's take a look at this. This is an FPD I had to replace on a patient. And, you notice that the terminal abutment is a wisdom tooth. And we all know that wisdom teeth are very short and very hard to prepare and get axial wall length. So I want to try something fun here. I'm going to take the bridge on the die and I'm going to pick it up and I'm going to turn it over. It doesn't fall off. I'm going to now shake it and it still is not falling off. Okay, pretty retentive. Those bridges are not light, they're very heavy. So hey, let's turn it over. Make sure there's no rabbit up my sleeve, no wax, no glue. But take a look at the prep. Look at how short that prep is. It's a wisdom tooth. But what kept that FPD in place when I turned it upside down and I was shaking it? Right? That groove. So our resistance and retention came from the buccal groove. There is one on the lingual as well. Now, I want to move from posterior FPDs to anterior fixed partial dentures. Also, that's a concept and treatment that's kind of being lost and pushed to the back because of implants are removable partial dentures. And there's an important concept in RPDs, and that's the retentive fulcrum line. And the retentive fulcrum line is defined as follows. It's an imaginary line connecting retentive points of clasp arms on retaining teeth adjacent to mucosal-borne denture bases. This imaginary line connects the retentive points of clasp arms around which the denture tends to rotate when subjected to forces such as the pull of sticky foods. Okay? So rotation occurs on a line drawn between the two teeth closest to the edentulous area. And this is what we have to take into consideration when it comes to the anterior FPD. So, clinical situation. We're missing two centrals and a lateral. We have one lateral remaining and two cuspids. So we're going to make an FPD, all right? Should we keep and utilize the lateral in this FPD? So I want you to think back to tension versus shear. When you look at the design of an FPD, cuspid to cuspid, keeping one lateral, the compression is going to be on where the central pontics are. The fulcrum line is going to be placed between the lateral and the contralateral cuspid. So you can see as compression occurs, rotation is going to occur around the fulcrum line. The lateral will actually now be under compression, but the cuspid behind it will be under tension. So actually now the stronger tooth is at more risk of failure. So in this case, the better consideration would be to sacrifice the lateral and make a cuspid to cuspid fixed partial denture. So these are the kind of forces that you have to think about. Maximize compression, minimize shear. And hopefully, with understanding that and applying that towards the treatment you want to render using a fixed partial denture, you will make better decisions and have longer lasting restorations. Hope that helps. Thanks.